My name's Aaron Levo. I'm the Vice President of Communications and Public Affairs. Happy to be here, as always, moderating our town hall, our bi-weekly town hall today on February the 10th. We have a packed agenda, as always, with lots of information about our pandemic situation, our operations, and other important things occurring across the organization. We will pause at the end for celebrations. We have given the opportunity for those that had questions from our last town hall to ask them using the HHS News at hhsc.ca email inbox. And again, today, as you hear our presenters, if there's something that you want clarity on, you can always email a question to that forum, and they will follow up directly with you via the communications team to make sure that you get all the info that you need. So as we go through, think about your questions and think about your celebrations, because we'll have an opportunity at the end to make those known. So to kick things off, I'll ask our President and CEO, Rob McIsaac, to open things up. Rob, over to you.
Thanks very much, Aaron. Good morning, everybody, and thanks very much, as always, for joining. As we begin, I'd like to acknowledge that, excuse me, we're privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. I'm going to keep my remarks brief this morning, as we have a full agenda to cover off. As I shared in my email to everyone last week, Hamilton's hospitals continue to labor under the weight of the Omicron wave, together with the burden of illness in our community. Our reality locally and across our region remains highly pressured, and we continue to see an inordinately high demand for hospital care. I'm sure Sharon Pearson, when she speaks, can provide you with the numbers behind that. The province recently issued a revision to Directive 2 to guide the resumption of some hospital services that had been previously paused. Mostly did not affect us at HHS. Yesterday, though, the Ontario Hospital Association indicated that a full lift of Directive 2 is likely imminent. As we continue to face occupancy pressures well over 100%, as high as 120% at some of our sites, at Juravinski particularly, Hamilton Health Sciences, unfortunately, is not yet in a position to resume business as usual services on any significant scale. We have to maintain access to urgent and emergent care, and any ramp-up plans will proceed very gradually, keeping that principle in mind. Thank you all for your continued commitment to your patients, teams, and our community. I know everybody is doing the very best they can every time they come to work. I'm sure also that there are lots of times when you feel like your best just isn't enough, given the challenges that you're facing. Just want to say, despite some very challenging times in our society and in our community, your contributions matter a lot, and our efforts to provide care to our patients are hugely meaningful for our community. So as always, thank you all for what you're doing to help get us through this very challenging situation. I'm going to am I turning it over to Sharon?
No, next up, actually,
Okay.
I think Dave McKeag, our EVP of Corporate Affairs and Chief Financial Officer, will join us for an update. Dave's going to talk a little bit about the Assessment and Testing Center and a reminder about boosters and access to booster shots in our community. So Dave, over to you.
Thanks, Aaron. Thanks, Rob. Good morning, everyone. Happy to deliver what I'm going to call some good news, that we're actually closing the West End Assessment and Testing Center. And the reason for that closure is that volumes were so low. And that's a kind of a wonderful thing to see the need for PCR testing reduce. We were providing that on a priority basis for healthcare workers through our employee health services. And it is something that we were pleased to be able to do, but just the volumes weren't there anymore. So that's a good news story. So those that were working in that clinic will be returning to their home units, which is also a good thing in terms of being able to help elsewhere where we need it so badly. You'll still be able to get a PCR test if you need it. The St. Joe's clinic remains open at Upper James. Appointments can be booked online 7 days a week. It is not hard to get an appointment. We made these decisions, by the way, in consultation with all of our citywide partners around capacity for testing. Eligibility remains the same, by the way, up at St. Joe's. So symptomatic healthcare workers and symptomatic members of their household are able to book and test, or asymptomatic healthcare workers with a known exposure to COVID. So important to continue to follow the employee health services processes and notify them if you are symptomatic. And I do want to extend some thanks. I'm always for two reasons when I extend thanks. Number one, I hope I don't flub any names, and number two, I hope I don't miss anybody. But I certainly did want to extend some thanks to the flexibility and the push and the pull throughout this whole COVID, really, for having a vaccine clinic, not vaccine clinic, testing assessment, not testing assessment. So been some tremendous operational flexibility there. Very much appreciated. Certainly Lucas and Carrie Lynn, who I've had the most contact with, but also Marcia Sterling, Deb Wilson, Susan Fucciarelli. Hi, Susan. Erica Malo, Eric Hollerman, Jesse Caraballo. There's all kinds of people, and of course all the staff that worked very diligently to provide those services to our physicians and staff. Just thank you so much for all of that important work, so we could keep everyone as safe as possible. So anyway, that is that announcement. Well, I guess the announcement I think already went out, but just some of the details behind it. So thanks again to everybody. Also then, just a reminder for boosters and or third doses, depending on what the first dose may have been, but the reporting of the third dose is something we would continue to invite you to do online. It's the same process, it's the same links, it's the same system. You go into CORT and you indicate date and what kind of third dose you had, and you would upload your QR code provincial document. So if you could please consider that and do that for a couple of reasons. Number one, it does give us a better picture of how our booster, our population, our healthcare workers in our hospital are vaccinated. And secondly, we are required as an organization to report to the province on the status of that. So having better information, more accurate information is a request from the province and from your leadership team here. Of course, getting a booster is still very highly recommended. It is not mandatory under our policy or provincial direction, but still very highly recommended. I think a little bit later, Dominic will be showing some of that information, but vaccines and boosters do offer great protection against severe illness and hospitalization or even death. The rate of ending up in an ICU, I think, is something like 12 times higher if you are not vaccinated. So still continue to promote that and hope that everyone has taken advantage of the lots of opportunity and capacity in our city for getting your booster shot. So with that, I will turn it back to Aaron.
Okay, thanks very much, Dave. Next up, we will have an update from Dr. Dominic Mertz, our Medical Director of Infection Prevention and Control. I know I've always felt it's a great benefit to hear directly from one of the leading minds in this area, and Dominic's kept us up to speed throughout the pandemic as to what's happening and what we need to know. So here again, to cut through the noise with the saber of science, is Dr. Mertz. Dominic, what do we need to know this week?
Yeah, thanks, Aaron. I hope you haven't over-promised, and I will not spend as much time on vaccines today as I probably should have, given Dave's notes previously. But let's look at the epidemiology first. I will come back to vaccines. Again, case numbers, I'm only showing you this one slide because they aren't very meaningful anymore. All you can see here is that, yes, we continue as a nation heading down in terms of case numbers, which come with all the limitations of limited access to testing. Next slide. Much more, well, first the provincial numbers here as well. And I think what you can do, given that we had changes in testing criteria by January the 31st, that probably case numbers after that are in itself consistent, and as such the drop that you see here is clearly a true drop in case numbers out in the community, but aren't necessarily comparable anymore to what we would have seen last year. Next slide. I just added here a few time points, and I will come back to that later. It's only like the last part of this figure, which starts to give you an idea of the potential impact of ending the modified stage 2 by January 31st. So it's too early to tell whether there's any impact from that first stage of reopening. Next slide. In terms of hospital admissions, and that's where our data is stronger because it doesn't depend on access to PCR testing. You can see that at the provincial level, we had a very significant drop, probably around 40% from peak, and are now comparable to where we've been at peak mid-April 2021. Next slide. I showed that before. This remains relatively stable. Roughly 55% of patients are deemed to be due to COVID, hospitalized due to COVID, rather than based on the provincial data. Next slide. In terms of ICU admission, things get better at a similar or even faster pace at the provincial level. As you can see here today, we are on the 430s, and it continues to decline. So that's the blue line. The orange line gives you the number of ventilated patients, which declines at this very similar pace. Next slide. And again, more than 80% of those in the ICU are considered to be in the ICU because of COVID rather than with COVID. Next slide. The Hamilton view in terms of case numbers, similar picture as what you saw at the provincial level. Next slide. Again, more meaningful, our hospital admissions with COVID, and what you see here is that we have, let's say, less of a decline, which explains some of the bed pressures we continue to have. We have a roughly 20, maybe 25% reduction, less than on the provincial average in terms of COVID patients in hospital. Next slide. From an ICU perspective, a similar pace as what the province has on average. And in terms of numbers in the ICU, we are currently where we've been at peak of the fourth wave mid-September, or at the end of the June, or well, April, May, the third wave when we came down around mid-June, or where we've been pretty much a year ago, end of January 2021, just to give you some context what those ICU numbers mean compared to our historic ICU numbers. Next slide. The city now presents a different metrics also, and this is for Hamiltonians only, so those who live within the public health unit of Hamilton, and shows you the new admissions, the daily new admissions. And you can see here that until end of January, it was relatively stable and then started to drop. And we certainly hope that this decline continues. We are currently admitting roughly 6 Hamiltonians per day with COVID. ICU continues to drop as well, as you can see at the bottom. No cases yesterday, 1 case per day in the days before. Next slide. This is a new screen that I wanted to show you, which is put together by the Kingston Public Health Unit, which shows you peak-specific number of ED admissions on top, ED visits on top. In the middle, you see respiratory-related syndromes in those visits. And at the bottom, you see positive COVID cases. This is for everyone considered pediatric, so up to including 70 years of age. And this is specifically for Hamilton, which shows you a significant drop of any types of respiratory related syndrome presentations in our EDs since the beginning of January, and it remains very low, much lower than where we've been in November and December 2021. So that's good news, and the COVID cases continue to decline as well. Next slide. Now to the provincial predictions. I cannot show you the city ones. They will be shown at the Board of Health on Monday only, so I will be able to share those at the next town hall. The provincial ones had been updated again last week, and you see a number of plausible scenarios here. The color scheme is based on how many people would have had or are estimated to have had an Omicron infection in the last 6 to 8 weeks. So that's your sort of natural immunity boost on top of the pre-existing vaccination rate of around 90% at this point of time. And then you have the dotted line, which is with additional boosters. So you either have the 8 million boosters or the 10 million boosters, which is the dotted line scenario. And what you can see here, first and foremost, we don't really know very well how many people have had COVID over the last 6 weeks. Estimates are somewhere between 1.5 and 4 million. The models that you see here are going from 2 million to 3 million. And you can see that really the key, which will sort of predict what's going to happen end of February, beginning of March, will be how many people do have immunity from Omicron at this point of time. And if it's 3 million and more, you're following the green line. If it's only 2 million, then we expect another increase in hospital admissions very soon. The good news is the black line here is tracking at or actually below the best case scenario. We are sitting at less than 2,000 hospital admissions today. So already better than the best case scenario. So hopefully that predicts us a better future than if you are looking at the yellow or red line here. Next slide shows you the ICU admissions. And here similarly, we are following that best case scenario so far, with cases continue to drop. In a week or two, we will know better in terms of what will be the trajectory going into March. Again, lots of uncertainty as you can see here, with that broad range, gray area that gives you the range of what can be or has to be expected. Next slide. As Dave mentioned, one slide again on vaccine effectiveness, and he already gave you, I think, the key information here, which is if you're vaccinated either 2 or 3 times, that's put together here, you're 12 times less likely to require an ICU admission than if you're unvaccinated. And with 3 doses, it's lower than with 2 doses, but that's not separated here. Roughly a 6 times reduced risk for requiring hospital admission, and at this point, roughly 2.5 times lower risk of getting infected to start with. So again, vaccines are holding up very well to prevent severe infection, even in the context of Omicron. Next slide. This is how our local vaccine coverage looks like, and you can see that down to age 60, we are above 90% single and double vaccinated, 70 to 80% are triple vaccinated. And all of those metrics sort of go down the younger the people are, but even our teenagers are more than 80% double vaccinated. And the 5 to 11-year-olds are currently at 50% single, 22% double vaccinated. I think where we still see the gap is in terms of 3rd doses in that population that benefits most from it, but have had a 1st and 2nd dose already in mostly the 50+ population, where you have a significant gain in protection with the 3rd dose. Next slide. This just gives you an idea of how many vaccines are being administered at this point of time. That's the black line. This is the city of Hamilton, and you can see that it's only a small number at this point. We had that huge surge in terms of vaccines, thanks to the third doses, and then the 5 to 11-year-olds becoming eligible, where number of vaccines administered per day increased very significantly, but it's now dropping down into the area where we've been back in November, because we opened up to those populations. First and foremost, at this point, it's third doses that are being administered, followed by second doses, and only small numbers of first doses, which are mostly the 5 to 11 years old that haven't been vaccinated yet, but are coming forward at this point of time. There's been a question around fourth doses. This is currently reserved to a very specific population residing in long-term care, as well as heavily immunocompromised individuals, and is not being opened up for anyone else. Next slide. Which brings us back to how will the next few weeks and months look like? I think the question that everyone would like to have an answer to. And I think I've shown you there's lots of uncertainty, even when you think about the next few months. And it's one of those situations where we can certainly hope for the best based on what's currently happening in terms of the provincial numbers, but at the same time we have to prepare for those sort of worst case scenarios. And the two key factors that will determine how this will look like is immunity. So first and foremost, the percentage of people infected by Omicron to date, probably in the range of 25%, but again, we don't know for sure, and how the vaccine rates or vaccination rates may continue to go up, hopefully. And the second is the effect of reopenings. And as I mentioned, it's early days now to interpret any impact on those. And at this point, we expect the next step of reopening 3 weeks later, so February 21st. And then plus potentially the VOC, so any new VOCs or BA2, which is in the news, depending on how this will behave. But so far, it looks like it's not replacing our current Omicron strain to a significant amount. And as such, the current scenarios, which wouldn't include BA2, seem to be still very plausible. Handing over to you, Aaron, because I lost track who's going next.
No problem. Thank you very much, Dominic. Next up, we have Sharon Pearson, our EVP of Clinical Operations and our Chief Operating Officer, to give us an update on what's happening across our sites and services. So Sharon, over to you.
Great. Thank you, Aaron, and good afternoon, everyone. Dominic's presentation was a nice backdrop for our pulse check on our sites today. So you can see our regular table in terms of our COVID activity. The numbers are down in terms of the COVID positive. So we are up into the 200s at our peak today, sitting at 132, and our ICU numbers continue to decline, but still a pressure that we'll talk more about on our services. But we do have 14 less than 5 ECMO patients and have seen a reduction in our outbreaks now from a high of 12 down to 3, which is great news for the units and for our flow as well. On to the next slide. Our occupancy at that aggregate level is just hovering there at 100%, and ICU occupancy sitting at 90. You have to remember these are point in time and aggregate measures as well. So typically we see much higher numbers. We'll look at a couple of those in a minute that reflect that. The general and the JH occupancy, I should add West Lincoln also sitting around 120%. That's the measure of today. So all of our acute sites very highly pressured for access and flow with the demand, particularly for unscheduled medicine patients. And you can see our ALC numbers there. If you go to the next slide. We talked about the lower outbreaks. Our volumes are relatively flat if we have returned to our pre-pandemic ED volumes, but our occupancy remains pressured. That in part mostly driven, one, by COVID, but also by the outflow. And we've talked about these town halls, the pressures that our partners are feeling in-home and community care and in the long-term and other housing settings. So that is affecting our discharge dispositions for our patients. So at one point, we were very close to 100 ALC months ago, and we're double that now. It's sitting at 200, keeping in mind that almost half of those patients are within the satellite health facility. To offset the pressures, we are relying heavily on our unfunded bed capacity, and that's sitting at 86 beds open to try to mitigate the pressures that the sites are feeling with a number of patients. Our children have also experienced pressures through this wave that we've talked about. The medicine beds are sitting at full occupancy with their surge. As well, we've had ongoing NICU pressures throughout the last few months, working with our partners to do some census balancing and assisting us there. Dominic talked about the good signs in terms of the effect on the RSV, so that's good news in reducing some of the pressure at the site, seeing that reflected in our ED volumes and slightly in our ICU admissions. Next slide. In terms of our health human resources, we do continue to have a number of staff deployed to offset the number of staff in isolation. It has come down considerably, which is good news. The count on February 9th was just shy of 200. We are working on getting the remaining staff redeployed back to their home units, but that will be a slow and gradual return as we have to first mitigate the pressures we have on the units. And the next slide, Rob referenced the Directive 2 that was partially lifted, and it did allow some resumption of DI, cancer screening, some of our ambulatory care clinics and our pediatric activity planning and process to do some of that. But as he mentioned, we are anticipating hearing that the directive will be completely lifted and we'll be able to resume the non-emergent and the non-urgent surgeries. The caveat to that, though, I have to emphasize is that is very much dependent upon our capacity, our staffing, and our physical capacity. So it will be a very slow and gradual process for us. We will keep you updated on that. The groups are looking at step by step how we can start to return staff and reduce the pressures at the site. And with that, I will hand it back to Aaron.
Thanks very much, Sharon. Next up on our agenda today, we've got an update around our Employee and Family Assistance Program. And to help us with that, our Vice President of Human Resources, Michelle Leroux, will kick things off. So Michelle, what do we need to know about this?
Thanks, Aaron. Yes, it's a pleasure to be here to introduce Homewood Health, who will be supporting HHS as of March 1st. Homewood Health is a trusted Canadian company. I'm sure many of you have heard of them. They're a leader in mental health and addiction services. And honestly, we're thrilled to have them be here to support our staff, our physicians, and our residents. I cannot say enough about Homewood Health, and Cindy's going to join us in a moment to actually walk you through very high level a few slides. So hoping you'll get a chance to go back and look at those slides after. And also there'll be other opportunities through our comms to get to know about Homewood Health and what they can provide us. But they do have an extensive number of counselors and professionals available across Canada. I have used their services in the past. I can speak very highly of the support that you can get through them. So again, thrilled to have them here. So with that, I'll pass it over to Cindy and I'll join back at the end.
Thank you. Hi there. So we're very excited to be able to offer the services to Hamilton Health Sciences. With your Homewood Health, or with the Homewood Health Employee and Family Assistance Program, there's three different components. You've got your counseling services, you've got, which are the reactive services, you've got your proactive services, so lots of online resources for you to access. And then there's the lifestyle coaching services. So that includes life balance, health, career, all of that. Next slide. Accessible 24/7, 365 days of the year. Homeweb.ca, go there to register as of March 1st. You'll be able to either, if you call in or use the chat line or use the online booking, you'll be able to book an appointment or access the help right away if you're in crisis. We ask you a series of questions to determine if you are in crisis, and we'll go from there. It is a short-term counseling model for the most part, but you also have extended services. And if we determine that it is a longer-term issue that you're working with, then we can help bridge the gap to maybe community services, provide referrals to physician, that sort of thing. Next slide. Multilingual, diverse clinical network. They do have expertise in all different areas. They do have to have a minimum of a master's of social work. This is for employees, family members, eligible dependents, totally voluntary, no cost to the user. We have two different types of cognitive behavioral therapy. One is online, so that is you working through the program. If you're suffering from depression, anxiety, or just general mental health. But also for you, we've added mid to longer term counseling, depression care and trauma care. They cover up to 20 sessions with specially trained counselors. Again, it is a cognitive behavioral therapy. Next slide. So your privacy is very important to us. We don't share any of your individual information with your employer. They will not see John Smith attended nutritional coaching. It's very high level. They'll see 25 people attended nutritional coaching. You can call us directly. You don't need to go through your leader. We will ask you if we can leave a telephone message. It's important if you say no, then you need to watch for our calls. The calls could say private name, private number. So that's important to know. Flexible scheduling, morning, noon, night. Next slide. Accessing the FAP. So again, March 1st, just reiterating that, homeweb.ca. I encourage you to sign up, available 24/7. You can book an appointment or you can access the help right away if you are in crisis, totally voluntary and confidential. Next slide. And that's over to you, Michelle.
Thanks, Cindy, and thanks for joining us today. So just to summarize, we are transitioning from our current provider to Homewood Health on March 1st. Please visit the hub where you can find the links and more information to come. Employee Health Services will again be there to support and help direct and give us guidance on all of the tools available to us as staff, physicians, and residents for our health. And keep an eye out for more communications to come. But again, looking forward to working with Homewood Health and to all of you as of March 1st to be able to access the great tools that they have. And with that, I'll turn it back to you, Aaron. Thank you.
All right, awesome. Thank you very much, Michelle and Cindy, for all that information. Next up on our agenda, we'll be hearing from Dr. Barry Lum, and I believe also Michelle Liefler, to talk about Odyssey, our Project Odyssey work, which is accelerating, and we'll be hearing more and more about in this forum as we now approach, I think, probably into the final 4 to 3 months or 113 days, if I'm correct, I think, Barry. Anyways, over to you guys to tell us what we need to know this week.
Thanks, Aaron. Hey, everybody. Thanks again for the opportunity. I want to start just one more time on behalf of the Odyssey team and personally to say once again how grateful we are to the incredible work that all of our employees have done during the COVID pandemic. We are really very much in awe of the work you've done. But you know, I also want to acknowledge the incredible amount of work that the Odyssey team has continued to manage during this once in a lifetime pandemic. We could not possibly be so close to the finish line without the team's commitment to the project. They may be relatively invisible to you, but they are working so hard, and we're so proud of them. So as you can see here, we've entered the 4th phase of our journey towards the Epic Go Live. And this is really one of the most important phases of the project as we get ready to go live. And it involves all kinds of aspects, including training, readiness activities, demos, and other opportunities for you to learn how our new system will work. And it really just starts on June the 4th as we begin to realize the benefits of the Epic implementation. and the improved patient care and safety that we will realize, the ability to respond to the current or the next pandemic. And truly, we believe that your work will get easier once the system is up and running. Next slide, please. So as Aaron said, we're 113 days from flipping the switch to the Epic Go Live. Last week, we marked a huge milestone in the project when we conducted the 120-day Go Live Readiness Assessment, or the GLRA. We had over 250 of our leaders and project team members on the event, and they learned about what the status of the project is right now and what we need to do over these next 113 days to be ready to go live. And I can tell you that there are many areas of the project that are absolutely on track for the successful launch. But no surprise, there are always a few areas that are behind schedule, and that's exactly why we do these GLRAs, so that we know ahead where we need to focus our attention and to develop mitigation strategies to be able to do that. So there are strong strategies in place to move us forward, excuse me, and they will be at least partially, if not fully addressed by the time we get to the next GLRA, which is at the 90-day mark, now scheduled for the morning of March the 2nd. If you haven't seen it yet, I'd encourage you to look to the very exciting video that Colonel Chris Hadfield presented at that session. It's available on the hub, and I would really encourage you to take a moment. He did a fantastic job, and it is quite inspiring. From now until June, we're going to be proceeding step by step, and we're keeping a very close eye on the progress we're making so that we're sure that to do this as right as we possibly can. You will be seeing frequent updates here at the town hall and in many other forums as we get closer and closer. Next slide, please. I hope you already know. If you don't, I hope you will soon. That training is available now to start, and we would encourage you to take the opportunity to sign on to the LMS and start to do your e-learning vignettes or videos. They're excellent, they're short and to the point. And I encourage you to go back again after that when you've got questions to refresh your understanding. So please, if you haven't had the opportunity yet, please sign on and have a look at the e-learning and start to do some of that work. If you're having any trouble accessing the e-learning, please don't hesitate to reach out. On the provider side of the equation, you'll see a specific email, and then on the end users side of the equation, a second email at the bottom of the slide. Our leaders are assigned to register all the members of their teams for the in-class training, and that work is progressing really well. We are over 50% registered on both sides of the equation. And so it really has been tremendously encouraging to us that people have taken this on, and we really, really appreciate the work that you've already done. Also, for leaders who are involved in the registration process, there will be, and there is now, in fact, a new registration dashboard available to you that will allow you to look at the progress of your team, who's in, who's out, and to help you understand where you're at, and also to compare yourself against your peers. Next slide, please. And just as a reminder, there's lots of other upcoming events and activities focused on readiness occurring beyond just the training piece that you've heard about. One of them is called the Technical Dress Rehearsal, which will begin in earnest on February the 28th and continue for several weeks. This is where every device on the clinical side of the organization needs to be tested to be sure that it can interact correctly with the Epic environment. We want to try to minimize the disruptions as much as we can, but I have to tell you that this is exceptionally important, and I hope you'll welcome the team as they arrive on your unit. If you want to see the schedule of when people are coming, that's available on the hub. And for our friends at MAC, we just want to say thank you. They have been doing some preliminary testing over at Mumsy these last little bit, and so far, we're actually quite encouraged. Things are going well. For those of you who may be super users, there will be information coming out very soon on what that means for you and what your training agenda and so on will look like. We're planning the super user training to begin on the week of March 21st and extending through April the 1st. So please, for those of you who are super users, keep an eye out, more information to come. And finally, if you didn't see it, please take a few moments to share your awareness about the Odyssey project in a short summary that we have now that's been sent out via dispatch. It really does help us understand and determine where our gaps are and how we can serve you better as we try to get to the go live. And the last slide, please. And of course, just one more time, anytime, reach out to us at odyssey@hhsc.ca, and please keep an eye on the Odyssey Hub updates on the Hub. And I'm going to pass the baton to Michelle, who's going to tell you about some technical work that's happening imminently. Michelle.
Super. Thank you, Barry. And good afternoon, everybody. Just want to take a second and talk about a major outage that we'll be having. In preparation for our Odyssey Go Live, our network is undergoing significant upgrades. Transitioning to that new network is a really complicated and complex project that requires many outages as we upgrade the equipment. Since we began our work in 2021, we have already had approximately 30 scheduled downtimes. But why am I here today? On Saturday, February 19th, we will require our biggest outage, and it's going to run for approximately 4 hours. It's going to impact many systems, Meditech, Connexol, Silvera, and others across all of our HHS campuses. So just today, I wanted to remind you to please ensure your units are familiar with your downtime procedures. And given the scope, we're going to continue to reinforce this message in upcoming events and downtimes communications via the Hub and dispatch as well. So thank you for just letting me briefly update you on that major outage. We look forward to your ongoing patience and support. And with that, I'm going to pass the baton back to Aaron.
Okay, thanks very much, Michelle. Important info there. And thanks as well to Dr. Lum. Always a pleasure to have you guys giving updates on Project Odyssey. So for those that have questions that might arise as a result of things you heard today, the best way for you to get an answer is to email hhsnews@hhsc.ca. And we'll make sure that we get a response to you very quickly using the content expertise to help formulate that response. And you can also, should you wish, email ideas for future topics for this town hall, which occurs bi-weekly, and that feedback is always appreciated. Okay, so now, as is our practice, we'll conclude with celebrations. This is an opportunity for our panelists or for our participants to call out or celebrate something that you've seen, something you've experienced, a colleague. I see in our participants, Dr. Fox Robichaud with a hand up. Allison, would you like to celebrate something today? You can go ahead right now.
Thank you, Aaron. I just want to remind everybody that this is Resident Appreciation Week, and anybody around, shake a hand, give a high five, whatever, to the residents and clinical fellows who keep our hospitals running.
Awesome. Thank you for calling that out, Allison. And so there you go. Give a high five, shake a hand. Good stuff. Next up, I see, who do I have here? I see a hand up from Lucas Milanovich. Lucas, why don't you go ahead? What would you like to celebrate today?
Thanks, Aaron. I would just like to celebrate and recognize the virtual care operations team, namely Claire O'Connor, Julie Matthews, Pooja Patel, and Rachel Smith, as well as Dr. Natya Raghavan and Dr. Mohammed Ganju for their support in launching the virtual home GIM clinic across both EDs. That is starting to see referrals come in and allowing patients to get home sooner. So great work, and thanks to those who got it off the ground.
Awesome. Thanks very much, Lucas. Leslie Coach, I see you with a hand up. What would you like to celebrate today?
Yeah, so good afternoon, everyone. I just want to acknowledge that Gail Johnson's retirement will take effect at the end of next week. And many of us have worked with Gail for many years in many roles at HHS. Most recently, she's been the lab director, executive director for HRLMP, and has really made phenomenal contributions through the pandemic with all of the COVID work in the lab. So just want to congratulate Gail on her retirement, and on behalf of HHS, we're wishing her all the best.
Awesome. Thanks very much, Leslie. And Sharon Pearson, I see you with a hand up. What would you like to celebrate today?
Thanks, Aaron. Would also wish the very best for Gail. She has made inordinate contributions to HHS for many, many years. So best wishes to you, Gail. And as you depart, would like to welcome in Neil Johnson. Neil started with us last week. He has replaced Ralph Meyer as the new VP Oncology and the Regional Vice President for Cancer Care. So you will see Neil in the hallways of the JH and the JCC and other places of HHS. So welcome to the team, Neil.
Awesome. Welcome aboard, Neil, and thanks very much to Gail. Great celebrations. I see here we go in our chat from Michelle Cardozo, celebrating all the radiation therapists at Juravinski Cancer Center who continue to provide excellence in care. Despite numerous pressures, they have been tirelessly working at the front line without any significant reduction in volume. They are awesome. Thank you very much for that, Michelle. Any other celebrations, you can, of course, type them into our chat forum and I'll read them out, or you can raise your hand, either our panelists or our participants, and I'll call on you to give your shout out live. Sharon, I'm going to assume that that's a hand from the last one.
It is an old one. I'm sorry.
It's perfect. So just I guess a final call for celebrations, anything you'd like to recognize, anything you'd like to point out is occurring in our space, things we need to know. You can type it in the chat forum or you can raise your hand and I will read it out. Or you can type it in the chat forum and I'll read it out. Or you can raise your hand and say it yourself. One of the two. Okay, Leslie Gauthier, back on camera.
I'll do another one.
What do you got?
Yeah, so just a big thank you to all of the teams from the lab, health, safety, and wellness, our employee health teams, our site directors, really good work in pulling together the processes for all of our staff to self-swab if you're unfortunately on outbreak units and need to do that. It's been a great team effort and really hopeful it's providing an easier model for everyone to get their swabs done. So thanks to everyone involved.
Good stuff. Thank you for that. All right, well, I think we'll close it out there. Thank you everyone for your time. Rob, over to you for closing remarks.
Yeah, thanks very much, Aaron. Maybe I'll start by just a small well, not small, but a celebration to finish off the celebrations, to acknowledge the announcement today of Dr. Menaka Pai as our new lab chief, head of HRLMP for both HHS and St. Joe's. She is, an exciting new leader amongst our stable of chiefs. So congratulations to Dr. Pai, and many thanks to Dr. Smija, who has been in that role on an interim basis for some time. So thanks, Dr. Smija. Congratulations, Dr. Pai. We continue to have very competent, capable hands guiding our lab work. To finish off the day, thanks all for attending. As you heard, I think we know that we continue to be super pressured and facing lots of challenges, but at the same time, it does seem that there is some room for optimism in terms of where the pandemic is heading. So I think we need to hang in there for a few more weeks before we start to see hopefully some return to normalcy. But I don't think, given where we've been, I think things are looking about as good as we could have hoped for. So that's something to be grateful for. Thanks all again for attending. Hope you all have a great rest of the day, a great rest of the week. Cheers, everyone.